So one of the things that's important is when we're palpating, we want the patient to be flat. So we're not going to have anything under the knees at the moment. We can do that after, when we leave them on the table, but we want them to be flat to begin with.
Więc ważne jest to, żeby pacjent leżał płasko na plecach, bez niczego podłożonego pod kolana. Możemy podłożyć coś później, jednakże na początek musi leżeć płasko.
Now, normally you want to also put the patient at ease, so instead of palpating right away, an easy thing to do, which will also give you some information, is to lightly put your hand on the lower burner.
I chcemy też na początku rozluźnić pacjenta, więc zamiast od razu przechodzić do palpacji, można położyć rękę najpierw na dolnym ogrzewaczu,
And then put it on the middle burner,
następnie na środkowym
and then put it on the upper burner.
i na górnym ogrzewaczu.
The point of this is to actually feel the difference in heat between the three levels.
I celem tego jest wyczucie różnic w cieple na tych trzech poziomach.
What we would like to feel is the lower burner is the warmest, with Mingben burning and really heating up the body.
I tak naprawdę dolny ogrzewacz powinien być najcieplejszy.
Then we would have the middle burner being slightly less warm, but still active.
Środkowy ogrzewacz powinien być nieco mniej gorący, jednakże wciąż aktywny.
And comparatively the upper burner being the least warm, where there's the most amount of chi.
I w górnym ogrzewaczu, gdzie jest najwięcej chi, powinien on być najmniej gorący.
With him they're all pretty much the same heat, which is fine.
U Pana tutaj jest mniej więcej takie samo rozłożenie ciepła, co jest jak najbardziej w porządku.
But if you do feel the upper burner being warmer than the middle burner, or the middle burner being warmer than the lower burner, that could be a sign that there's a disequilibrium between the three burners.
Jeżeli wyczujemy, że górny ogrzewacz jest cieplejszy niż środkowy lub środkowy cieplejszy niż dolny, wtedy może to wskazywać na brak równowagi pomiędzy trzema poziomami.
Okay. So now what I'm going to do is I'm going to palpate the midline to begin with.
Jonathan zacznie od palpacji linii środkowej brzucha.
And I'm going to palpate the horizontal line at the umbilicus after.
A następnie przejdzie do palpacji linii poziomej brzucha.
Okay. The palpation is not going to be looking around or searching. It's going to be down and up.
I palpacja nie będzie polegała na rozglądaniu się czy poszukiwaniu, będzie polegała na uciśnięciu i rozluźnieniu odcisku.
So I will come here and I'll start at Renmai 4.
I zaczniemy na Renmai 4.
Okay. And what I'm going to do is I'm only going to use the tip of my middle finger and I'm going to go straight down.
Jonathan użyje tylko koniuszka palca wskazującego i będzie uciskał w dół i zwalniał.
So I'm going to go down, and when I start to feel resistance, I push against the resistance and I come up.
Więc kiedy Jonathan natknie się na pewien opór, trzeba dalej przyciskać, żeby przejść przez ten opór i wtedy podnieść palec do góry.
Now I'll ask, was that sensitive? No.
I wtedy pytamy, czy było to bolesne.
Okay. In a normal, healthy abdomen, you can go as deep as you want and the patient won't really feel any pain or any discomfort.
Przy zdrowym brzuchu można zejść z uciskiem tak nisko, jak się chce i pacjent nie powinien czuć żadnego dyskomfortu.
So I'm going to palpate the water or kidney area first.
Najpierw Jonathan będzie badał palpacyjnie rejon nerek lub wody.
Can you tell me if any of these points are sensitive?
Proszę powiedzieć, jeśli któryś z punktów będzie bolesny
Or different from the other points.
albo będzie był odczuwany inaczej.
So there, Renmai 4, Renmai 5, Renmai 6, it's okay. And then we can also check Renmai 9. Nothing there is sensitive. Okay? Renmai 9 is on the border of earth and water. So if it's only Renmai 9, you have to take a look at the rest of the pattern to know if it's reactive because of earth or because of water.
Renmai 9 znajduje się na styku ziemi i wody, dlatego jeżeli będzie to jedyny punkt bolesny, trzeba sprawdzić oba te obszary.
So now I'm going to palpate the earth region. So I'm going to go from Renmai 9 to Renmai 13.
Teraz przejdziemy do obszaru ziemi.
Okay, and you tell me if any of these points are sensitive. I'm going down and I'm coming straight up. I'm not massaging anything.
I Jonathan niczego nie masuje, tylko uciska w dół i do góry.
I go down till I feel a bit of resistance, push and come back up.
Jeśli będzie opór, trzeba przez niego przecisnąć i do góry.
Were any of those points sensitive? Now I'm going to move into the heart area. So Renmai 14,
Przechodzimy do obszaru serca.
15, and 16. It's okay. And then we go to the heaven area, run my 17.
I obszar.
All those points were okay. He's probably a very healthy individual. Now we're
Like this one.
well, wait. Now I'm going to go towards me, so I'm going to do run my kidney 16.
Nerka 16.
A little bit of sensitivity there.
I think, yeah.
Then we have stomach 25. It's okay. And spleen 15. Okay. Now normally I suggest at the beginning you walk around to the other side of the table to have the same angle of pressure. When you're used to it in the clinic, I don't necessarily do that, but I suggest at the beginning you do that to begin with.
Na początku Jonathan sugeruje, żeby przeszli Państwo na drugą stronę stołu, żeby dokonywać palpacji pod tym samym kątem, jednakże w późniejszej praktyce można od tego odejść.
So let's see, kidney 16 on this side. It's okay. Stomach 25. It's okay. And spleen 15. So we only had one point on him, which is kidney 16 here, which is sensitive.
Sprawdziliśmy tylko jeden punkt bolesny,
Okay.
nerki 16.
So if I only have kidney 16, I'm going to be thinking I'm going to be tonifying kidneys, because it's the kidney area,
Tonifikować nerki.
right? So that is the end of my initial abdominal palpation. Now I'm going to see the points if they're active. So we will check kidney 7. Hold on. So here's spleen 6, kidney 7 is around here. Can you palpate around? Any of those points active? No? So tonifying,
Which meridian?
so as we had kidney was, right? So I was looking for the tonification point of kidney, which we'll remember was kidney 7. So kidney 7 wasn't active. Now we're going to see a bunch of other patterns that can also treat the kidney. I can say maybe his kidney is in excess, the meridian is in excess, okay?
Poszukamy teraz
So,
innych punktów, być może
I will check.
nerek jest w nadmiarze.
And tomorrow we'll see if it's kidney 3. Is that sensitive there? It's okay?
No,
Okay.
It's okay. It's okay.
So kidney 3 isn't sensitive. We'll also see that I can bring kidney yin into the body.
Możemy też spróbować
So I'm going to check
przywrócić
kidney 10,
chi nerek.
maybe a bit.
Maybe a bit.
Okay. And we can also see if I want to bring kidney yang. So I'm going to check the heart point.
Sprawdzimy też punkty serca,
This
żeby
is the
zobaczyć,
most.
czy możemy przywrócić yang.
Okay, so kidney 2 is active. You'll see this pattern tomorrow. We can also look to now see if kidney 8 is sensitive.
Możemy sprawdzić,
Sorry, heart 8.
czy
Yes?
serce
Similar,
8 jest
like
It's similar, perfect. Okay.
bolesne.
So we're going to tonify the heart yang. Okay? So, as we're treating kidney, we start on the kidney channel.
Jako że leczymy nerki, zaczniemy na meridianie, na kanale nerek.
So I find my kidney 2 point. I'm going to ask you, it's going to be tonification, so I'm going to ask you to take a deep breath in
Będzie to tonifikacja, więc proszę wziąć głęboki
and
oddech.
breathe out. I break the skin quickly and then I go down slowly.
Szybko przebija skórę i dalej wbija wolę.
Okay. Now we're going to do the same thing with heart 8.
Teraz to samo zrobimy na sercu 8.
Now when you're doing heart 8, a lot of people get worried, it's going to be painful. What I do is ask the patient to completely relax your hand in my hand. Give me all the power, all the weight there.
Prosi pacjenta, żeby zupełnie zrelaksował dłoń.
What this is doing is, first of all, I'm in control now, he's trusting me, but it's also relaxing the musculature here. So it's not going to be painful when I go in.
Teraz Jonathan ma pełną kontrolę nad dłonią, ale również dłoń jest rozluźniana.
So what I'm going to do is I'm going to break the skin quickly,
Szybko przebija skórę
and go down,
i schodzi w dół.
and that's it. Okay? So there I've done on the left side the tonification points.
Nakuliśmy punkty tonifikujące po lewej stronie.
And what I'm going to do, if I'm bringing in yang, I want to be reducing the yin, so I'm going to look for the water points on the same meridians. So I'm going to,
Teraz punktów wody na tym samym meridianie, żeby dodać yin albo odebrać yang.
so I'm going to be dispersing kidney 10.
Będziemy rozpraszać nerkę 10.
So take a breath in,
Proszę wziąć oddech.
and that's done. Okay, very quick. I think if you can put your arm here. And we're going to do the same thing for heart 3.
I teraz serce 3.
Take a deep breath in. I insert when he's breathing in. How's that now? It's gone.
Yeah.
Okay? That is how quick your results should happen.
I właśnie w taki szybki sposób powinny być rezultaty.
Okay? You put the needles in, you come back, the abdomen has changed. Okay? So you can see that the reaction is immediate from the patient.